Da 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 da. Hey everybody, happy Thursday. Happy Thursday. It is Thriving Thursdays with Dr. Marcie. I'm so excited to have you here. I love coming here with you guys, especially when we're talking about women's health, especially when we're talking about ways to help us not just live, but to thrive. Right? In 2019 is not just about existing, not just about going floundering and trying to just make it. We are wishing every woman and trying to help every woman start to thrive. What does that mean? Thrive, thrive, thrive. And so every time we come on here, every time you see me, I'm going to be talking about ways for women's self care, women's health, all things. And tonight is no different. I have an amazing guest. I can tell you that last night we did our prep call. We were like, oh, there's 15 minutes. We were on the phone for, I think, an hour and a half, Dr. Taft, right? We was getting it. Just,
yes, ma'am.
it just resonated with me, and I just could not wait until tonight. Hey, Ashley. Hey, Ash. Happy Thursday. So Dr. Tiffany Taft is here. I'm going to let her introduce herself and just tell you all the great things that she's doing. But just so you know, tonight's topic is all about maternal and fetal health. So any woman who is thinking about getting pregnant who is pregnant, I'm going to actually make this, I'm just glad I remembered, make this broadcast public so that everybody can share it on their feed, right? So everybody knows somebody who is either, a niece, a cousin, somebody who is thinking about getting pregnant who is pregnant that needs to hear this. So welcome, 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 Dr. Taft. I'm so excited to have you here.
Thank you. Thank you.
So tell us a little bit about yourself and your background and how you became a doula. So we'll talk all about what a doula is, but just kind of your background on your training and your passion and all the things that you're doing for women's health.
Yes. Thank you, Dr. Marcie. So I am Dr. Tiffany Taft, and I come from a traditional medical background, Western medicine, where I started out in the military as a hospital corpsman. So for those not familiar, it's essentially in the nursing. I did everything that the nurses did except for hold the keys to the narcotics locker. But everything else I did as a hospital corpsman. From there, I kind of migrated over to IT and project management type work. But healthcare has always been my passion. So in 2004, I migrated over into the health and wellness industry, and I started out as a massage therapist. Mm-hmm. So I went to massage school, and I have been doing massage professionally off and on over the last, since 2004. So that's 14 plus years now. And over the years, I have just picked up additional skills to cover things like yoga, aromatherapy, reflexology, prenatal, postnatal, prenatal and postpartum. I'm a doula and a childbirth educator. So I really run the gamut, if you will. I like to consider myself as an integrated health and wellness professional. Mm-hmm. And I use all of these tools to customize sessions for my clients. So there's not like a one size fits all. Whatever they're coming to me with, I use one or two or all of them if it fits to customize sessions to benefit them.
I love it. I love it. And that's almost like if you talk to any other woman in healthcare, a lot of times we start at some place and then you kind of get into your groove. You get to really what is your passion and what really drives you. And it sounds like really when it comes to women in terms of getting pregnant or trying to get pregnant or just in that phase of her life. And that's how you became a doula. So one of the things I know we talked about last night is like, so we talked about the services. We'll get a chance to talk about that. But I thought the best thing for me, at least as you were explaining it so well to me last night, like what is a doula? How do you differentiate a doula? How would a woman even think about having a doula?
Yes. So a doula is simply a woman that serves other women. We are an advocate for that woman during her prenatal and postpartum time. So we're really there to advocate for her. We help her design her birth plan. So how do you envision? Those are that's one of the questions I would ask as her doula. How do you envision your birth? What's the birth story you want to have for you and your baby? And it's my job then to not take over her story, but simply to advocate, especially on her day of delivery. I am there to be her mind, body, spirit, her source of calm and peace, while I coach her through this miraculous event, this journey, like no other that she will go through. And I'm an extension of her family. So I'm not taking the place of her husband or her partner, or her extended family members that may be present at the birth. But I am there to be that non-medical professional advocate for her.
I love it. So with Leslie's here. Hey, Megan. Hey, guys. Thanks so much for joining. So, Dr. Taft, when you say advocate, I love that word, right? I think that that's a very powerful position, right? Because it's like you said, it's not to take over. It's not to take the place. It's not to move anybody out. Like, I'm the expert, you guys move. It's like you said, to become an extension, right? So, in explaining what a doula is, tell us, like, when do you try to find your doula? When you're trying to deliver, or when you're thinking about getting pregnant? Like, what stage in this process would a doula come in?
Yeah. So I think at the point of probably even preconception, but definitely once you find out that you're pregnant, know that having a doula is an option to you. If you desire to have a more natural, holistic birth, meaning a birth that you don't necessarily have to deliver with drugs or medications or the traditional medical way, know that having a doula is a way to help coach you through those moments when you would get to the point where you would need some medical intervention in terms of pain relief. So ask your doctor. If you're seeing a regular OB doctor, ask that doctor. Hopefully they are well-rounded enough that they even know what a doula is. But if not, if you have a midwife, that midwife certainly will know what a doula is. If you're part of a birth center, they certainly will know what a doula is. And then, of course, if you have medical insurance, they may not, all medical insurances don't cover doulas, but they certainly probably have heard of them enough to say yes or no, they don't cover it.
Okay. So one of the things we were talking about last night that really stuck with me are the questions that you would ask. Like, you know, you mentioned some of the ways you would find a doula. It looks like I thought my computer was tripping. But like some of the questions, the way that you interact with the mother, I just thought was amazing. And it really resonated with me. Hey, Christy's here. The gang's all here. So what does that conversation look like? Because I can tell you that I have 2 sons, and I went the traditional route, and some of the questions that you asked, I never even thought about. Like, no one ever asked me. And I was like, wow, I can just imagine that experience with a doula, especially that connection you have, right? It's kind of like, and as a healthcare professional, I would have my marching orders: take your vitamins, do this, come to your visits, this is what you're doing, right? Very direct. I was just taking direction. This is what I need you to do. This is what we saw on a sonogram. This is that. And this is, this is what's happening this week. I just feel like it was more unilateral rather than bilateral, rather than back and forth. And so I love some of the questions that you asked the mother. So share some of those with us.
Yeah, so of course, in the traditional medical environment, doctors are limited in terms of the amount of time they are able to spend with mom. And so if you have a midwife, certainly that midwife is able to spend more time with you as the patient. And then your doula has even more time, and they are truly there focused on you and your needs. And while we don't provide the specific medical advice or prescribe anything, there are certain questions that we can probably help prompt our discussion that you can take back to your doctor or your midwife to, for consideration. And so some of those just come out naturally. We do our own form of intake as well. So I typically will do a 20 or 30 minute screening with my potential moms that I would take on as they're interviewing me, but I'm also interviewing them. And I really want to know what type of, if this is her first, if she even has a clue as to what it is that she wants, or what this whole birthing journey will be about. And so through discussion, I'm asking the basics. Are you on medications? Is this your first? Do you have support? And is that support on board? Are you being supported well in this pregnancy? Are there potentially other services that you're going to need? And if so, what does that look like? And I mean, financially, emotionally, physically, what are you going to need? And are you prepared when baby comes home with the resources that you're going to need at home? One of the other major questions that can naturally come up too, depending on how the discussion is going, is women that suffer from has suffered from sexual assaults or sexual trauma, because that birthing experience is going to be completely different for that mom than it would be for someone that has not had that experience.
Yeah. And that question to me, when it brought up, it was just like, wow, I think about my experience, but I never thought about it from a woman who completely had a different experience, right? And so, I pose this question to any of the viewers. It's like, I would love to hear, just chime in about what was your experience, right? And what was the experience, how you got pregnant, how did that affect your pregnancy, right? And then how afterwards, were you affected, right? I love that. How was your pregnancy experience? And then how did your pregnancy affect your life? So anybody have any comments on that, or just want to share anything, definitely put in the comments. Dr. Taft would love to chime in and answer any questions that you may have, things that you may have not thought about before. And so those are some of the things that I think is important. Another thing we were talking about was just like the chakra, womb cleansing, and then infertility. So if you could touch on any of those, that would be fantastic.
Yeah. So at the very foundation, right? Hopefully before we as women find out that we're pregnant or in a pregnant situation, that we have done all we can to make sure our female health is optimal in the physical sense, but also more emotionally more so in the emotional sense. Our womb is sacred, and it's a portal of energy. And so if it's not healed or well, know that baby is marinating in whatever stress and anger and frustration and negativity that still remains there. So the more you can do to help facilitate that healing of yourself first, will have, your experience of pregnancy will be a lot better. And that child, those behaviors that, may be negative on the other side once the baby's here, probably will not exist.
Right. Yeah. Yeah. And so I think that's important, right? And then you talk about like infertility, and also again with the wound and what's going on inside of you. And like, I don't know I know I didn't really think about that, right? Yeah. Because I didn't have any overall health issues and I was in a good space and all that. But I think about, even with a second kid, life is much different, right? I have this toddler and then I have this newborn, or I'm trying to at least conceive. And I can tell you with my first son, it was like, ta-da! And then with my second son, it took us a long time to conceive. And I think that was, as you and I were talking, I really think that there was some stress there. And so that impacted. And they're two different people, but they're very drastic in their personalities. Very, very different. Megan asked a question about miscarriage. Can miscarriage be tied to health issues?
Absolutely. Yes, absolutely. And so, Megan, I'll share. I myself had a miscarriage. So my miscarriage was twofold. It was a physical issue as a result of fibroids that I had. So my fibroids actually outpaced the growth of my baby and essentially suffocated the baby. but I was also under a great deal of stress at the time. And so with that, of course, very early on in the pregnancy, I think I was around 16 weeks, 18 weeks when the miscarriage happened. So the stress on the body and the baby that early on just was not good in combination with the fibroids that I had. So had I had the knowledge that I have now about the fibroids, I would have, and I did, honestly, I tried, several different interventions over 7-year period. Some holistic, some non-holistic, and I wasn't able to get rid of mine or shrink mine. So I ended up having to go the surgical route, but absolutely a miscarriage can be tied to a health issue.
Oh, hey. Oh, yeah. Well, sorry. Megan says sorry to hear that, for sure. So we talked about fibroids. So how do we get our womb healthy? Like, what are some of the things we can do?
Yeah, so at the top of the list is minimize or get rid of stress where you can. Say no and know that no, N-O, is a complete sentence, and be okay with that. After you do that, looking at your diet. What are you eating and putting into the body? Especially for women of color, the foods that we eat, and especially if they're the traditional comfort foods, are not always best for our womb. And if you are a woman of childbearing age, we have to be mindful for a very long time what we're putting into our body. Also, sexual partners. Who are you connecting with? And know that if you have multiple partners, know that you're connecting with the partners that they have been with also. So being selective on who you allow and share that most intimate moment with. If there's actually something physically wrong, go and get checked. Don't be in denial about it. Have both. I say have both. Have your regular doctor, but also if you're more into the natural healing, find providers that are willing to listen and willing to work with you, and a plan that's going to work for you, because you don't want them to, prescribe or plan something for you and you're not going to be committed to working the plan.
One thing you mentioned for the first one was reduce stress, but one thing you mentioned about sexual partners is that the pH, especially, hopefully no one's out there having unprotected sex, right? But unless you're with a committed partner and you're going through your testing. But the pH of the different sperm can also affect your body, right?
Yeah.
So that also needs to, take into consideration. That also affects your womb.
The more alkaline you can have your body, the better. And that's with your foods as well as the water that you drink. But yes, absolutely. There's different chemicals in the male sperm. And so not every male partner that you have will interact in the best way, let's say, with your body. Your body may actually have a physical reaction to that.
So Leslie asked a great question about being over 35 when you want to have a baby.
Mm-hmm. Yes. So traditional medicine will tell you that at 35, you are considered a mother of advanced maternal age, and that you're essentially too old. That puts you into more of the complicated obstetrical patient. And just know, if you are in good health, great health, that it really doesn't matter the age, but you do want to make sure that you are aware of all of the potential additional precautions that you may need to take because of your age, especially if you have a health history extensive with some pretty, critical things, because anything that you walk into pregnancy with is only going to be enhanced even more during the pregnancy.
That's a great answer. I think we have a few other questions come there. Oh, thank you, Meg. She loves our glasses.
Oh, thank you.
She agrees. Meg says stress-free zone. She meditates and basking in her Mediterranean island. Oh yes. Where are you going, Meg?
Yes.
So we're in Hawaii. All right. Yes. Rod says no. She loves the word no. I think we had Candace on here. I saw Candace Camille. Hey, Candace, if you're still on, thanks for joining us.
Hi, Candace.
Hey, Tiffany. Thanks so much for being on. We're talking about maternal and fetal health, right? If whether or not you're thinking about having a baby or you're already pregnant, then you can, this is great information, right? We already always know a woman that is either trying to get pregnant or pregnant already. So if you're here, please share this information because this is critical. We talked about ways to have your womb healthy, reduce stress, nutrition, any physical illness, and also being able to be very in tune with your sexual partners. And not to have multiple partners, especially understanding the dynamics between the vagina and the sperm, right? The uterus and cervix and the sperm. So you have some great things going on, right? So can you tell us about the things you have going on in terms of helping women who are in this phase in their life?
Yeah. So, one thing I did want to mention, unless you're going to get to it later and you can just tell me to stop and hold off on it. But I wanted to mention the statistics around maternal fetal deaths and the increase of that.
Right.
So over the last 5 to 10 years.
Brought it up. I'm like, yeah.
Okay. So go ahead now. It's fine.
Yes, absolutely.
Okay. So over the last 5 to 10 years, there has been a significant increase. And I don't have all the refined numbers before me, but just know the United States is in the very top 10, we'll say, numbers of high rates of maternal fetal deaths. And we are a developed nation. And so there is absolutely no reason, as far as I'm concerned, or very little reason why this should be happening. And it's happening in great numbers to women of color. And so the more knowledge you have and the better you're armed and walking in with your own health and your own questions and being your own advocate. And even though if you have a traditional medical doctor and you know their time is limited, make them stop and listen to you or find another doctor, because the doctor that's not listening to you doesn't really have your best interests at heart, right? And this is probably the hardest job that you will do in your life. And it's a long time. 40 weeks, 10 months is a long time. But your body from the point of conception is doing major work in a short amount of time. So it requires you to be on your top game. You got to be 100% the whole entire time. So having said that, I am offering a class next month, and it's called the Sacred Womb. It's birthing from within, and it's coming from a yoga perspective, right? So I'm just covering foundational. So this class is good for women that are already pregnant, or even if you're thinking about getting pregnant. But if you have a yoga practice already and you're pregnant, I'm going to be covering some foundational poses, because as your body progresses through the trimesters, there are 3 trimesters in a pregnancy. So as your body grows and your baby grows, you need to adapt your yoga practice to that. So there are specific poses that we want to adapt just to make sure that you and baby are safe. So I'll be covering some of those. I'm also covering nutrition for 2. Because what you're eating now won't do for when there's 2 or more if you're having multiples on board. Your caloric intake will significantly have to be increased. And so if you're already not eating for whatever reason, that's just not going to work and have a really viable pregnancy. So I'll be covering the foundations of that. I'll also cover basic terminology in the maternal space. So things that you'll see, words that you probably haven't heard or they've been called something different, we'll cover those. And an intro to anatomy. What's happening to your body? Do you even know what your non-pregnant body is, where your parts are? It's amazing. We go for our exams annually, and if you're not, you should be. And we still don't know what our female parts are and what they do. And so our body is changing during this pregnant time. And so we want to understand what those changes are. And that's what a doula helps you to understand. They help you to understand and prepare you for the changes that are coming so that when they're happening, you're like, oh, she did mention that, or it's okay. I don't need to be freaking out and calling the doctor every 5 minutes because something is changing. So that's one of the classes that I'm holding. And then for the non-pregnant people, or even for the pregnant people, I'm doing in acknowledging Valentine's month, not just the day. So it's a month of love, and I'm calling it Aroma of Love. And I am offering massage, couples instructional massage. So either come to my office, or I'm willing to go remote if you're here in the DMV area. There is an additional charge though if I come remote to you, but I'm willing to do that. And in there, I'm giving, each person gets a 30-minute professional massage from myself, but then I also teach you, the couple, how to massage each other. And so we'll pick, you tell me what are your areas of concern, and I'll show your partner how to help alleviate some of that stress and pain for you.
I love it. So let me just say, I don't know if you can see all these comments, but they are blowing up. I love it. So I want to get to the programs and I'm going to get to the comments. But what I want to do first is kind of back up, because I did have awareness on as first for us to talk about, because I got so excited about this conversation. I think that is critical. That's a critical piece. I'm so glad that you went back, because sometimes we think, oh, we're America, or we're here and it's fine. We have all these services. But like you said, this is something that's happening. They've already talked about infertility with women. So there's definitely something happening. There are a lot of fetal deaths. There are a lot of unhealthy pregnancies. This is an issue. And so I'm so glad that you brought that to our attention about the numbers. And so one of the things we also talked about that I want to also bring up is why. Why do you think this is happening?
Some of it, and it's not just my opinion, and it's been documented, some of it can truly just be tied to lack of access to care. My number one, though, is lack of education. We just don't know. We don't know what we don't know until it's in the news, or you read about it, or somebody else tells you about it. Or you find yourself pregnant and things start happening, and then you got to find out about it. So education or lack thereof, access or lack thereof. And you probably have heard there's been several stars like Serena Williams. She almost died. Preeclampsia. It's a huge condition, potential, I'll say, during a pregnancy. And she's here in the States, and she is a top athlete. Beyonce also had issues in her pregnancy. Kendra, I think is her name, from Real Housewives of Atlanta.
Yeah.
Kenya. She also had issues. So it's not just your everyday woman. It's the people that we see as stars, and they're professional women. And yes, we can do everything. But when your body is in a pregnant state, if you weren't already listening to your body with the little hints, you definitely have to listen to the body when you're pregnant.
And you said we can do everything, but should we do everything? That's the thing, right?
No.
It's like, okay, sometimes your body needs to
rest.
It needs to rest. It needs to restore. Mm-hmm. It needs to calibrate. You have a lot of things that are going to be imbalanced throughout the day. So that you need to sit still, see am I drinking enough water? Am I doing this? Or how's my pH levels? All those things matter, because I can tell you one thing, you would be looking like you cracked and on the floor, but that baby be fine, because all your resources are going to that baby. Everything you feel, you eat, everything you do is going to that womb. Every nutrient you eat is going to feed the baby first. And so it's important for you to be, it's important for you to take the time to take care of you and that baby. Mm-hmm. Right. Yeah. And I love what you're saying. And also I keep going back to the advocate, because this is no longer the time for us to be told what we're going to do. We need to advocate for ourselves. We need to ask questions. We need to say no mas. We need to sit back and say, we're not going to do that. I'm not going to have all these things on my back and have everybody thrive at the detriment of my own health, right? So this information and this acknowledgement, this permission to be like, you know what, I need to ask these questions. I'm not just going to hand over these decisions to someone else. So definitely thank you so much for being here. I want to talk about programs, but I want to make sure we get to these comments. Thank you, Megan. She agrees. Every woman needs to hear this. This is really great information. So Tiffany had a question about, is it safe for a woman to have natural birth after a C-section?
Absolutely. And that's a conversation that you would have with your traditional medical provider or your midwife. That's part of your medical history. So don't be afraid to share everything. This is not a time to be hiding medications you're taking. If you're doing substances that aren't officially legal, that's not a time to not be, telling people about it. Sexual partners, sexual STDs or STIs, which are sexually transmitted infections. This is not a time to not tell, because those are things that can harm the baby as the baby grows, may even kill the baby before the baby gets here, or may cause deficiencies at the time of delivery. And so don't be shy. If you need to tell someone, and that doesn't necessarily have to be your doula, but a doula is a great place to start, because if you haven't told anyone else, at least that doula is aware. And when you get to the point of delivery, she can say, hey, do you guys have XYZ, depending on what you shared. And
that conversation is easier than having your OBGYN, right? Because it is more of a conversation rather than, oh my gosh, I'm going to tell this authority figure that I've been, I smoke marijuana, or that I may not know exactly who the daddy is. Or I'm back and forth with my two boyfriends or whatever. Like, it could be like these things happen, right? It's not always cut and dry. Sometimes it's a very complicated situation that we find ourselves in. And so being able to have this conversation with someone is really, really important. So I love that you're saying this. Thank you, Leslie. We agree. Share. This is great information. Miracle work for sure. I know I saw another question here. Okay, so so Megan, did we answer your question? Yes. So Megan also asked about miscarriage. I'm so sorry to hear about that, Megan. In 2017, she had a miscarriage with her first pregnancy, and it's still very, very traumatic. We can only imagine. We do have some good news with Chrissy. Congratulations, Chrissy. She's expecting. She's 9 weeks. So it's very, very exciting. And so she does have a midwife and who's sending her to a specialist in April. They will give her a recommendation to prevent preterm later. And she doesn't feel it's necessary, but her midwife definitely feels differently. And she's looking for some guidance on who to listen to. Like, she doesn't think it's necessary. Is a midwife being overly cautious? What should she do?
I'm sorry, overly cautious about sending her to a specialist?
It's because she was considered preterm because she delivered her son at 34 weeks.
Okay. So not having, I guess, all of the detail behind why the other child was delivered early, it's probably not being overly cautious. I would say go for the test, because it's better to know than not to know and be in that same situation again. Even if you got a little further along, again, not knowing what the background is for you there, it could be something that could be prevented prior to you getting to that point in the pregnancy. So go.
We vote go. Yeah. Thank you guys for sharing this. I know one person will be like, oh my gosh, thank you. I came across this and it changed everything. They may have a daughter or a niece or someone who definitely is in this stage in their life. We answered about the 35 and older. I think we had answered all the questions that are there. for sure.
Okay.
So if you guys have any other questions, thank you for those of you who have already shared this. Please, if you have not shared this information, like I said, this is our time to thrive, not just live, not just survive, but to thrive. Oh, yeah. It's stress related. She wanted to, me to take some shots. Okay. We vote go. We vote go to the specialist. Okay, so your February, what is it? The couples.
The couples instructional massages.
Aroma of Love, right?
Aroma of Love. Yes.
And the other one is the one that
Yoga Foundations class. It's a prenatal yoga foundations class, and it's called the Sacred Womb, Birthing from Within.
Right. I love that. As I flipped through, I was looking at this. We were talking last night. I was writing notes all over the place. One thing I love that you said is your inner fitness. Like, I love that, right? Because we always think about the exterior. I know I do. I'm like, oh, am I looking snatched? How I look on the outside? But, and I have a healthy heart and all that and healthy digestive system. But when you said inner fitness, I just thought that was amazing. I love that so much. So tell everybody what you call inner fitness.
So for me, inner fitness, excuse me, it's just that. It's how can I have the best balance and the best version of me show up each and every day, and that I be fully present, not only with, the people in my immediate circle, but my clients and anyone that I would come in contact with. So yes, I want to, clean up nicely and look all pretty on the outside and have the package all together. But on the inside, what good does that do if you're a mess on the inside and you're emotionally disturbed and you're stressed out? And so for me, it's really having a consistent practice of meditation and balance and doing the things that bring me joy and fullness. Be in alignment and be intentional about what it is that you need and you want and you desire.
I love that. I love that. If you're feeling that like I am, say something on the message, because I love that. Okay, so Candace said her question wasn't answered. My bad, Candace. All right, so is there a way to reverse PCOS other than weight loss?
Give me, what is the PCOS?
I don't know. I'm not sure. So what, Candace, tell us what PCOS is. And while you type that in, Roz had a question. After a miscarriage, is it possible to get PTSD?
So it is possible. So PTSD is post-traumatic stress disorder. That can happen from any type of trauma. And having a miscarriage is certainly considered a trauma. It's an emotional trauma. And for women, it can be one of the most devastating types of traumas. And depending on how violent that miscarriage was for you, it takes a while to physically recover, but even longer to emotionally recover, because there's always the questions of, what did I do wrong? And why did my body fail me? And so know that every baby that is conceived is not necessarily meant to make it here. And the body naturally did what it was supposed to do for a reason. It's okay. I've suffered through one, and it was traumatic, and I took the time. Take the time to heal for yourself. Understand physically and medically what happened in your miscarriage, but don't stay there, because if you desire to have more, you can't get stuck there.
Yeah, it's difficult. I also suffered from one who would have been my third baby that I carried, and it just wasn't meant to be. And so for me, it was, being in the healthcare industry, being a healthcare professional, I understood it medically, and I understood what my body was releasing, and that emotional hit for me didn't come until later. After I processed physically, I found that I wasn't sad, but then several weeks later, I just cried and I just released it because my emotions kind of caught up with the logic of it. And so I think, don't stay there, but also be sure to honor your feelings and don't stay
Absolutely.
in an
Honor
unhealthy either.
Absolutely honor those feelings, and know that, I mean, the miscarriage. So you were pregnant, so your hormones started to rise, your levels started to rise. You have a different set of hormones than the non-pregnant body.
Mm-hmm.
So some of that are hormonal changes that you're going through. Once that body re-regulates itself, if you're still stuck there for months and years, you need to talk to somebody, professional or not, but you need to get it out.
Yeah, I agree. So let me first answer. Shalika had a response to Tiffany and just said the shots are highly recommended for patients with history of preterm deliveries. They are not for stress. So just so you know, Christy, I want to double back with that. And then Candace had answered the PCOS, cystic ovarian syndrome.
Okay.
Go back to her question about what it was connected to.
Other than diet, I think she said.
Yeah. Is there a way to reverse it other than weight loss?
I honestly, so I'm not going to answer it because I honestly can't say without doing a little bit more research on that. But I have heard diet is a major way to do that. I've also heard women having had to have surgeries to remove the cysts or the polyps.
Yeah. Okay.
So
hopefully that answers the question.
If it's a syndrome, I'm wondering if it's a genetic something that they were born with. I don't know. I would have to read more about it.
Okay. All right. So Dr. Taft can read up on that and then maybe answer your question or double back with you. Or you guys can message each other. That was a great question. Or if anyone else has an input that's still on the line, that'd be great. Okay, Tiffany, also, my miscarriage actually revealed something that helped me to have a healthy pregnancy after that, but it was still traumatic. Yeah, you can understand that. Thank you, ladies. This has been great. I told you this is going to be a good one. I love it. Thank you guys for sharing. Thank you guys for interacting and just being here. We know that this is important. We know that this is not like fluke things that are happening. The energy that we carry translates to our womb, to our chakra. And so we need to make sure that if we're bringing new life into this world, we're thinking about it, that we need to be healthy from within. We need to have our inner fitness. I love that so much. If you have not shared this already, please share. You guys know this was dope. I love it. So Dr. Taft has 2 activities happening. She has her February Aroma of Love. And so would someone register for that?
So I actually have it out on Eventbrite. But if you have additional questions, you can check out my website at sacredsoulwellness.org. Or you can check it out on Instagram. I do have some flyers on Instagram, and it's Sacred Soul Wellness on Instagram.
Okay, so sacredsoulwellness.org.
Yes, is the website.
And on Instagram, it's Sacred Soul
Wellness.
Okay. I'll put on Instagram. You can also inbox her here on Facebook. Just a message, a private message, Inner Fitness. I know, Kim, that's awesome. Like hashtag Inner Fitness. I'm gonna start that hashtag. I love it. If you want to reach Dr. Taft of anything personal, feel free to message her on Messenger on Facebook. She's very responsive.
And if you're looking for a doula and you're not in the area, your doula doesn't have to be co-located with you. They can be anywhere. The only time they physically need to be with you is at the day of delivery. So I am open to new clients or helping you find a doula in your area if you're looking for one.
Thank you for that. That was awesome. Yay, everybody. This is great. Yeah, no, I love it. Thank you, Dr. Taft. I can't thank you enough. Thank you so much for educating me and educating and connecting with all the women on here. Again, I know that it sounds repetitious, guys, but please share this. As you guys know, this is critical the more that we know. Dr. Taft already said that awareness and education was one of the biggest reasons why babies are dying and that wombs are not healthy. Women have infertility and so many challenges that come with it. But just understanding that they are not alone, they have advocates for them. And so they need to understand that so many times we just think traditional, go to the OBGYN and just kind of surrender to that. And that does not that does not have to be everybody's story. And so be sure to share this out so that someone who needs to hear this gets this. All right. I love you. Love you. The doulas are awesome. Yes. We definitely are a fan of doulas. Thank you, guys. Thank you, Dr. Taft.
Thank you.
Share, guys. Please leave a comment. If you happen to be listening to this on the replay, please leave a comment, and we love to hear from you. Dr. Taft is very responsive. She can continue to answer your questions and connect with you. Good night, everybody. I'll see you later. Bye, Dr. Taft.
Bye.